repair a lot of different equipment, anywhere from weed eaters to 60,000-pound Vector trucks for sewer equipment, police cars, police motorcycles. Pretty much everything the city has we repair. Yeah, about 3 or 4 years ago, we didn't have all the tools we needed, and I was always bending over to pick up, like we had some of the drums you pick up are, they're way up to 100 pounds, and you had to pick those up to put them on the rear ends. We have the one impact gun for the big trucks. It takes just a two-hand operation. It weighs about 30, 40 pounds. So you're holding on to that gun probably a half hour, pulling the trigger and using the gun the whole time. I was getting to the point where I wasn't able to do my job. I didn't realize how much it was bothering me because it came on over a period of about 10 years of doing the big trucks all the time. Before I knew it, I was driving home and my arms, I would have to switch arms. If I was going over 15, 20 minutes of freeway, I'd have to switch my arms because I'd just get tired and I didn't realize what was going on. I finally went to my doctor, and he's the one, found and goes, well, yeah, you do have a problem. That shouldn't bother you to do this, And so I had to take 3 months off to recuperate. My doctor's actually the one that told me what motions were bothering me. The biggest problem I had was using a twisting motion, like just turning a regular screwdriver. That motion in particular hurt my arms the worst. Then after that was just, if I had to hold anything for any length of time. With the ergonomics people, I told them what bothered me the most, and then they helped me find the tools to eliminate those motions as much as possible. They bought me new air tools, air ratchet, instead of doing everything by hand with a hand ratchet. I got a cordless impact gun that goes 60 pounds, good cordless screwdriver. Now we have a dolly that's actually made for it, and they actually lift the drum up and put them on the spindle. Ergonomics has been very good for me. They allowed me to keep my job, stay with the same profession that I went to school for, and without them I would have had to change my whole profession.
Motions are considered highly repetitive when you use the same part of your body to make the same motion over and over again without pauses. Most repetitive motions involve the hand, wrist, elbow, shoulder, and neck. Making the same motion repeatedly can cause a lot of wear and tear on the joints, and if you don't allow time for them to heal, the damage can build.
Repetitive motions may be required by your job. However, a lot of times you have some control over what motions you make and how often you make them. Things you can do to reduce repetitive motions include: arrange work to avoid unnecessary motions. Let power tools and machinery do the work. Spread repetitive work out during the day. Take stretch pauses. Change hands or motions frequently. If possible, rotate tasks with coworkers.
I've been working here for 28 years. I've been grading for 18. You look at the lumber and you decide what should be cut off, what shouldn't be cut off, what you can let go. When you had to turn it over by yourself, that's mostly what the job ensured, was just getting that darn thing over by the time it got by you. It was a heck of a lot harder to get your mind into what you were doing, because most of the time you were physically working hard because it was heavy work, especially when you got on the big lumber, like 4x6s, 4x10s, 4x12s. I mean, you really had to reef on them to get them over. And you'd have a sore back, aching muscles all the time. Your wrists and your hands hurt. There's no problem now. The lumber comes down, and it'll hit these flippers. When that piece of lumber gets in front of you, it turns itself over. You got more time to think because of that machine turning it over for you. You want to come to work and do the job now because it's a lot easier and you don't have to worry about getting hurt.
Intensive keying involves highly repetitive movements of the fingers, tasks like data entry or transcription. Usually, you don't have to worry if you key for less than 4 hours a day. Keying for longer periods, though, can create a risk for hand or wrist injuries.
However, intensive keying can be stressful for your whole body, especially if you work in awkward postures as well. There are several things you can do to reduce the risk of injury from intensive keying. Spread keyboard work throughout the day. Take stretch pauses. Improve your posture and move around as much as possible.
Repetitively using your knee as a hammer, such as this carpet layer is doing to stretch the carpet using a knee kicker, can damage the soft tissues in the knee. Similarly, there are many soft tissues in the palm of your hand that are easily damaged when using the palm as a hammer. Fortunately, there are easy solutions to these risk factors. There are power stretchers available for carpet layers that don't require a knee kicker. Tools like rubber mallets can be used in place of the palm in many cases.
Most people are aware that lifting heavy objects increases the risk for injury. Fewer people know that repetitive lifting and lifting even moderate loads while bent over or reaching out can be just as hazardous. When you bend over to pick something up from below your knees, not only does your back have to lift the object, but it also has to lift the weight of your upper body.
Something else to keep in mind. The same stresses are there when you lower something as when you lift it. Look for alternatives to lifting, including hand trucks, conveyors, carts, and other mechanical assistance, or if these aren't available, get help from a coworker. Avoid storing things on the floor unless you use a hand truck to move them. Store them on a surface between knee and waist level instead.
Stacy and I are with the lift team, and we're a special response unit for the nurses, a resource for moving patients that they feel they need assistance with. The lift team got started in response to nurses' repetitive back injuries, shoulder injuries from moving patients. Our primary responsibility is a safe movement, whether it be from bed to chair, bed to gurney, chair to wheelchair, bed to wheelchair, wherever the patient needs to go. Not putting ourselves at risk and not putting the patient at risk. Creatively using mechanical means whenever possible.
In the year 2000, we did over 7,000 lifts just during the day shift hours.
And again, just through sheer repetition, we've developed methods that have kept us from becoming injured, along with our stretching program that we enjoy every morning. So we're warmed up and ready to lift at 7:30. We're not hitting the ground cold. Also, we've made it a practice that on some of the busier days when we start to kind of feel fatigued, we have the authority to stop lifting and go find a quiet spot and for 10 or 15 minutes stretch and loosen up again so that we don't promote an injury.
When we initially started, the nurses, and they still are, they're very positive. They love the lift team. They're always talking us up and, you know, what would we do without you? And we wish we had more of you. We wish you were on a different shift.
Where our specialty comes from is in the safe, ergonomic moving of a patient from point A to point B, not putting ourselves at risk and not putting the patient at risk.
It's nice. It's a nice job to have.
Power tools can transmit vibration to the hands and arms. Not surprisingly, this has a number of effects on the body. If you're exposed to enough vibration, it can cause damage to the nerves and blood vessels in your hands and arms. Vibration also tends to make the muscles tighten up.
The tighter you grip the tool, the more vibration gets transmitted to your hands and arms, making injury more likely to occur. It takes quite a bit of vibration to actually cause an injury, but if you use a lot of power tools, you should reduce your exposure by using low vibration tools if they are available, keeping your tools well maintained, and keeping your hands warm. This helps to increase blood flow and minimize the damage that vibration can cause.
Now that we've got your attention, it's time to talk about symptoms. Most importantly, which ones to report. WMSDs affect the soft tissues of the body, the muscles, tendons that connect muscles to bone, ligaments that connect bone to bone, nerves, blood vessels, pretty much every part of your body that's not a bone or internal organ. Often, these types of injuries start out small, as a little muscle pull or a slightly irritated tendon. However, if a small injury isn't given a chance to heal, it can become aggravated, especially if you keep doing the activity that caused the injury in the first place. Over time, these small injuries can build until they become chronic, which is when symptoms don't go away.
WMSDs have many different symptoms, some of which you may have experienced at one time or another. These include discomfort, pain, numbness, tingling or burning sensations, swelling or inflammation, changes in skin color, tight muscles, or loss of flexibility in a joint.
Having one or more of these symptoms doesn't necessarily mean that you have an injury, though. Everyone has had muscle aches or stiffness after working or exercising hard, especially if you're not used to it. Usually, these symptoms go away as you rest or as you get used to the work.
That's different than symptoms of an injury, which last longer or include things like numbness and tingling that might mean something more serious is going on. Sometimes these symptoms make it difficult for you to do your job or things around the house, or they might wake you up at night and keep you from getting a good night's sleep.
The important thing is not to ignore what your body is trying to tell you. Often, simple changes to the way you work are all that are necessary to prevent these symptoms from becoming a WMSD. Of course, it wouldn't make sense to report all the little aches and pains you experience.
Yet some symptoms are serious enough to need attention. You should report symptoms if pain is persistent, severe, or getting worse. If the pain radiates, spreads, or travels down an arm or leg. If the symptoms include numbness or tingling, or if the symptoms keep you from sleeping at night.
When in doubt, it's better to report symptoms and be told there's nothing wrong than to wait too long. Some WMSDs can be very serious, resulting in lost work days, permanent disability, or even surgery. We can't stress this point enough. If you start having symptoms of a WMSD, be sure you report them early to avoid more serious injury. The good news is that early treatment is often very simple and successful.
Ergonomics. It's a tool you can use to make your job healthier and better.
By applying ergonomics, risk factors can be reduced and WMSDs prevented.
You are the expert when it comes to your job, and you can play an important role in your company's ergonomics efforts.
There are a lot of changes that you and your employer can make to the way you do your job that will make it more enjoyable.
Thanks for your time.
And attention.